I want to talk about seizures, specifically the overarching branch of epilepsy. So the person I interviewed, he's had seizures for over 10 years at this point, and he's been working with different doctors and different ways to solve having seizures. So we'll go through those types of experiences as well as the nuance within epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures. That means you have multiple seizures within, usually they consider it around 6 months. That's when you were considered an epileptic patient. At that point, you can get different treatments, you get on different drugs, different surgery options, and those sort of things. And then epilepsy also has just a really wide range of what types of seizures you have, what types of side effects it has, what day or what time of day it happens at. There are a lot of different factors that happen that come into play when you talk about a diagnosis. For my interviewee, he had just general seizures, but only when he was asleep. So sometimes he would have a seizure during sleep, and there is no real clear indication as to why, but it's something that's happened since he was 9. Living with epilepsy also definitely has its challenges. He explained that for him, it luckily doesn't make a huge difference in his day-to-day life per se. There are some experiences where it's made things a little bit more difficult. Things like he can be more tired in the morning if he's had a seizure, or even if he's recovering from some sort of injury, and we'll go into that in just a second. But his day-to-day is luckily not as challenging with epilepsy. It's not as much of a concern. But he definitely explained how big of a difference there can be between epileptic patients on how often they're having seizures, why they're having seizures, what are their triggers, and sort of things like that. Continuing on, for him, he's had some pretty serious injuries from his seizures, and it's not so much because of the seizure. The seizure itself is considered fairly minor, but because he can sometimes walk or because he can sometimes stand during the seizure, he's still not aware enough to be able to really control his body, and so he often will fall, or that's when injuries usually happen. So he's gotten like a concussion from falling into a bookshelf. He's gotten a lot of cuts and bruises, a lot of stitches over 15 years of having seizures pretty regularly, between 6 to 12 a year. For him, his impact on daily life, so luckily because his seizures only happen at night, it doesn't have as much of an impact on his day-to-day, like I said, but it definitely still has those lingering effects of lethargy, or any type of injury will last through the day, any type of those things. And then also challenges in relationships. He's also there's a really big stigma around epilepsy, of course, and people don't always understand it. And so when they hear the word epilepsy, it can be kind of scary. It can be understandably concerning. And so there's a lot of fear involved in that first reaction. But as soon as people kind of understand what his epilepsy actually is and what it means for those around him, it doesn't really become a problem. And luckily, he said he's always had really good parents and really good relationships with his siblings that have helped him in any situation that he's needed. So, impact on quality of life. Epilepsy can affect overall quality, but for a lot of people, but for him, he isn't able to drive at the moment, though he's working towards getting a license, and he is luckily lives pretty close to anything he needs at the moment, so that helps him feel pretty independent. For managing epilepsy, none of the drugs he's tried to this point have worked, which is unfortunately pretty common for seizure patients. He's also tried things like diets and different types of trigger pattern tracking in order to figure out what maybe would be a trigger. So far, none of them have really shown themselves, but he just depends on his support systems to get through the hard days. in conclusion, the person I interviewed was really open about his experience, and his key takeaways were that epilepsy has a significant and unique experience for each person. Also, that proper management of epilepsy requires a lot of people, a lot of different modifications to lifestyle and to drugs and other things, and that awareness can help prevent the fear that comes from epilepsy. So, yeah, thank you.